Have you ever sat in that doctor's office, on that crinkly paper and felt the clock ticking? You have a list of questions in your head, but the doctor seems so busy. You have maybe 10, 15 minutes if you're lucky. You walk out with a new prescription or a refill for an old one, but with a nagging feeling that you didn't get to have the real conversation you needed. You might have told yourself, well, the doctor knows best, or even, this is just part of getting older. I'm here today to respectfully and wholeheartedly challenge that last idea. Feeling confused, rushed, or unheard is not a mandatory part of aging. In fact, a surprising study has shown that older patients often receive less information from their physicians than younger patients, even though they desire more. That gap, that feeling of being on the outside looking in on your own health, is exactly what we're going to close today. Because taking control of your health isn't about challenging your doctor, it's about forming a partnership with them. And by the end of this video, you will have 5 clear, respectful, and powerful conversation starters that will transform you from a passive patient into an empowered partner in your own healthcare journey. Hello and welcome. I'm so glad you've chosen to spend this time with me. Today, we're tackling a subject that sits at the very heart of wellness for so many of us: our prescription medications. The title of this video talks about 5 questions you must ask, but I want to reframe that right now. This isn't about marching into your doctor's office with a confrontational checklist. It's about opening the door to 5 essential conversations. These conversations are designed to build trust, increase your safety, and ultimately improve your quality of life. This approach is rooted in a concept that major medical institutions like the Mayo Clinic and Johns Hopkins Medicine strongly support, called shared decision-making. It's the simple but profound idea that healthcare works best when the patient and the clinician make decisions together, combining the doctor's medical expertise with your expertise on your own body, your life, and what matters most to you. We'll be drawing on guidance from trusted sources like the National Institute on Aging and the Centers for Disease Control to ensure the information we discuss is reliable and actionable. We're going to walk through these 5 core conversations one by one. We'll talk about how to get absolute clarity on what you're taking and why. We'll tackle the fear of side effects head on. We'll make sure the instructions you receive are crystal clear. And we'll get to a topic that is incredibly important but rarely discussed: the idea of de-prescribing, or safely reducing the number of pills you take. I especially want you to stick around for that last point, because it's where a true feeling of control and well-being can begin. And a quick but important reminder: I am not a doctor, and this video is not a substitute for professional medical advice. The goal here is to empower you with the right questions and frameworks so you can have more productive, collaborative conversations with your own qualified healthcare provider. This is about education and empowerment to help you become the most effective advocate for your own health. All right, let's begin with the first and perhaps most fundamental conversation. It's what I call the what and why check-in. We all have it, don't we? The collection of pill bottles. Maybe they're lined up on the kitchen counter, or maybe they're all tucked away in a cabinet or a weekly organizer. Some of them you've been taking for years, almost on autopilot. The first step towards taking control is to get a crystal clear understanding of every single thing you're taking. Let's imagine a man we'll call Charles. Charles is a thoughtful guy. In his early 70s, he's diligent about his health. Years ago, his doctor prescribed a medication for high blood pressure, and Charles has taken it like clockwork ever since. But lately, he's been feeling a bit lightheaded when he stands up. Nothing dramatic, but it's there. He brushes it off as just a part of getting older. What he doesn't realize is that over the past few years, he started walking more. He's lost 10 pounds, and he's cut back significantly on salty foods. His body has changed. His blood pressure has naturally lowered. The medication that was perfect for him 5 years ago is now actually too strong, causing the dizziness. He doesn't need it at the same dose anymore, and maybe, just maybe, he doesn't need it at all. Charles's story illustrates a crucial point. Our bodies are not static. A prescription that was essential a decade ago or even a year ago may no longer be necessary or could even be causing harm. This is why the what and why check-in is so vital. The actionable step here is simple but powerful. Before your next doctor's visit, create an up-to-date, comprehensive list of everything you take. And I mean everything. This includes all your prescription medications, all over-the-counter drugs like aspirin or allergy pills, any vitamins, herbal supplements, or tinctures. Then, at your appointment, you can slide that list across the desk and open the conversation by saying, "Doctor, to make sure we're on the same page, I'd like to quickly review my full medication list with you. For each one, could you please remind me what condition it's treating and confirm that it's still necessary for me today?" This question is respectful, collaborative, and incredibly revealing. It's not an accusation, it's a request for confirmation. It turns autopilot into active participation, and it sets the stage perfectly for our next essential conversation. Once you have that clear foundation of what each medication is and why you're taking it, a second, equally important layer of questions naturally emerges. It's the layer that deals with the what-ifs, the anxieties that can keep us up at night. This is our second conversation, exploring the what-ifs of side effects and interactions. Let's be honest for a moment. This is a big fear for many of us. We start a new medication, and a few weeks later we feel a little foggy, or our mouth is constantly dry, or we feel a bit off balance. The immediate question is this a new health problem? Is it just me getting older? Or is it the medicine? Many older adults, let's call one of them Carol, have felt this anxiety. Carol grew up in an era where you didn't question the doctor. She was started on a new medication for her cholesterol, and soon after began experiencing persistent muscle aches in her legs. She mentioned it at her next appointment, but felt her concern was brushed off with a comment like, "Well, aches and pains are common at your age." Feeling dismissed, she didn't bring it up again. She just assumed she had to live with it. It was only much later, after reading an article online, that she discovered muscle pain is a well-known and sometimes serious side effect of the very statin she was taking. The truth is, your concerns are valid. As we age, our bodies change how they process medications. Our kidneys and liver, the body's great filtration systems, may not work as efficiently as they did when we were 40. This means that a standard dose might be too much for our system, increasing the risk of side effects. This can also lead to something doctors call a prescribing cascade. That's when a side effect from one drug is misinterpreted as a new medical condition, and you get a second drug to treat the side effect of the first drug. The action step here is to be proactive. When your doctor is prescribing a new medication, or even when you're reviewing an old one, you can ask, what are the one or two most common side effects I should watch for with this medication? And more importantly, what should I do if I notice them? Is it something I should call your office about right away, or just mention at our next visit? Then you add the second part of the question. Are there any potential interactions I should know about, specifically with my other medications, my supplements, or even certain foods or drinks? We've all heard stories about grapefruit juice, for example, but other interactions exist. This conversation isn't about being a hypochondriac. It's about being an informed and careful steward of your own body. Being clear on potential side effects is a huge step toward feeling safe. But that safety can be undermined if the basic instructions on how to take the medication are confusing or hard to read. This leads us right into our third and perhaps most practical conversation, the how and when, which is all about clarifying instructions. I want you to picture the standard prescription bottle. The label is covered in tiny, hard-to-read print. It might say something like, "Take 1 tablet by mouth twice daily." Simple enough, right? But what does twice daily really mean? Is that every 12 hours, like at 8 a.m. and 8 p.m.? Or is it just one with breakfast and one with dinner? Does it need to be taken with a full glass of water? On an empty stomach? With food? If you miss a dose, should you take 2 at the next interval, or just skip it? These small details can have a massive impact on how well a medication works and how safe it is. A pill that's meant to be absorbed slowly over 12 hours can become dangerous if you take 2 at once. A medication that needs food to buffer its effects can cause stomach upset or even ulcers if taken on an empty stomach. Here's a staggering fact from the CDC that gets to the heart of the problem. Research shows that only about 3% of adults aged 65 and older have proficient health literacy skills. Furthermore, about 2/3 of adults with vision problems are over 65. So when you're squinting at that tiny label, feeling frustrated, know that the system is often not designed with you in mind. It's not a personal failing. It's a systemic one. I remember hearing a story about a man who was supposed to take his medication twice a day. He was a busy man and found it easier to just take 2 pills in the morning to get it over with. He didn't realize it was a blood pressure medication that needed to be spaced out to provide steady 24-hour coverage. The action step here is to never leave the office or the pharmacy with ambiguity. You have every right to ask for clarity. You can say to your doctor or pharmacist, "To make sure I get this exactly right, could you please write down the instructions for me in plain language? Specifically, the best time of day to take this, whether it should be with or without food, and what I should do if I happen to miss a dose." Getting it in writing is key, especially if you're feeling overwhelmed with information during the appointment. And here's a powerful follow-up you can make at the pharmacy. Is it possible for you to provide this label in large print? Most pharmacies can and will do this for you. Forgetting is not a moral failing. It's a human one. Setting yourself up for success with crystal clear, easy-to-read instructions is one of the smartest things you can do for your health. Okay, let's just take a moment here to breathe and recap where we are. We've established the importance of the what and why check-in, making sure every medication on your list has a current and valid purpose. We've also talked about how to proactively discuss the what-ifs of side effects and interactions, turning fear into informed awareness. And we just covered the critical importance of getting crystal clear instructions on the how and when of taking your medicine. You can already see how these conversations start to build on each other, creating a much clearer picture of your health. The goal, remember, is partnership and empowerment. You are already on your way. If you're finding this guide helpful so far, if it's resonating with you, I would be so grateful if you could take just 1 second to tap that like button below this video. It doesn't cost you anything, but it tells YouTube that this is valuable content, and it helps get this information out to more seniors who, just like you, are looking for ways to feel more in control of their health. Thank you so much for that. Now, let's get back to it. Getting the logistics of your medications right is fundamental to safety. But once we have the what, why, and how sorted out, we can elevate the conversation. We can move from just managing pills and treating conditions to managing our overall health and happiness. This brings us to our fourth conversation, the bigger picture, which is about aligning your prescriptions with your personal health goals. For so many people, life can start to feel like it revolves around a medication schedule. Your day is punctuated by which pill to take at what time, rather than by the things that bring you joy, like tending to your garden, playing a round of golf, or having the energy to keep up with your grandkids. Medicine should be a tool that serves your life, not the other way around. Too often, the focus in a quick doctor's visit is on the numbers. Is your blood pressure in range? Is your A1C below a certain number? Is your cholesterol at goal? Those things are important, of course, but they are not the whole story. The real goal is your quality of life. I think of a friend's mother. We'll call her Margaret. Margaret's greatest joy was visiting her children and grandchildren, who lived in different states. But she was on a medication that required her to go in for frequent and inconvenient blood tests, making it a logistical nightmare to travel for more than a few days. She felt trapped by her treatment plan. Her lab numbers looked good, but her quality of life was suffering immensely. It wasn't until she finally broke down in her doctor's office and explained the situation that her doctor said, "Margaret, why didn't you tell me? There's another medication we can try. It's just as effective and doesn't require the frequent monitoring." This is a perfect example of how a treatment plan can be medically correct, but personally wrong. Your doctor can't know what's most important to you unless you tell them. The action step here is to think about your goals before your appointment. What do you want to be able to do? Is it to walk a mile without getting winded? To reduce your daily pain so you can kneel in your garden? To have the mental clarity to finish the crossword puzzle? Then you share that goal. You can say, "Doctor, one of my main goals this year is to have enough energy to travel to my family reunion in the fall. How does my current medication plan help me get there? Are there any non-drug options we could explore, like physical therapy or a specific dietary change that could work alongside or even potentially reduce my need for one of these medications to help me reach that goal?" This question changes everything. It reframes the entire purpose of your treatment, from simply managing a condition to achieving a life goal. It invites your doctor to be your strategic partner in living a fuller life, not just a prescriber of pills. When you start talking about your life goals, and you begin to question whether every single pill is truly serving those goals, you naturally arrive at a very powerful and increasingly important idea in modern medicine. It's a concept that can feel a little intimidating at first, but is actually one of the most proactive and empowering conversations you can have with your doctor. This brings us to our fifth and final conversation, the deprescribing discussion. I want to be very clear about this word. Deprescribing can sound radical, like you're just stopping all your medications at once. That is absolutely not what it is. Deprescribing is the planned and supervised process of stopping or reducing the dose of a medication that may no longer be of benefit, or may even be causing harm. It is always done carefully, thoughtfully, and in partnership with your doctor. It's the opposite of a reckless act. It is a deeply responsible one. The need for this conversation stems from a very common issue called polypharmacy. You might have a nagging feeling looking at that handful of pills in the morning. Do I really need all of these? Could one of these, or the combination of them, be why I feel so tired all the time? This feeling is often correct. Many symptoms that we chalk up to aging, like confusion, dizziness, fatigue, and falls, can actually be side effects of taking too many medications. Now, you may have tried to bring this up before and felt some resistance. It's important to understand why. Many doctors, despite their best intentions, lack specific training and guidelines for how to safely deprescribe. It's often easier and feels safer to continue a medication than to stop it. Let's revisit Charles from our first example. When his doctor realized his lifestyle changes had lowered his blood pressure, they worked together to carefully and slowly wean him off his blood pressure medication. That process, that was deprescribing. The action step here is to use a gentle, curious, and collaborative opener. You can say, "Doctor, I've been feeling," insert your symptom here. For example, more fatigued than usual, or a bit foggy-headed lately. "I'm just wondering if it's possible that this could be a side effect from my combination of medications. I've been reading a little about a process called deprescribing, and I'm very interested in it. Would you be open to working with me to review my full list and see if there are any medications that we might be able to safely reduce or even stop?" This language shows you're informed, you're concerned about safety, and you want to do this as a team. You can even mention that you know organizations like the American Geriatric Society support this approach. This isn't about throwing away valuable treatments. It's about pruning the medication tree so that what remains is only what truly helps you thrive. So there we have them. 5 conversations that can fundamentally change your relationship with your health and your healthcare providers. We started with the simple but profound what and why check-in, creating a solid foundation of understanding. We moved to the what-ifs of side effects, replacing fear with prepared awareness. We covered the practical, essential how and when of instructions to ensure safety and effectiveness. We then elevated the discussion to the bigger picture, connecting your medications to your actual life goals. And finally, we opened the door to the powerful and liberating idea of deprescribing. As we close, I want to leave you with this. These conversations are not about being a difficult patient. They are about being an engaged, informed, and active patient. You are the world's leading expert on one subject, your own body. You know how you feel day to day. You know what your hopes and fears are. Combining that invaluable expertise with your doctor's medical knowledge is the true recipe for optimal health. It's about building a bridge of trust and communication. It's about moving from a dynamic where you feel like things are being done to you to one where you are making decisions with your healthcare team. You have the right to ask these questions. You have the right to understand your treatment. You have the right to be a partner in your own care. This is the new standard of healthcare, and you are now equipped to be a part of it. Now, I would love to hear from you. Which of these 5 conversations resonated with you the most? Was there one that felt like a real aha moment? Is there a conversation you now feel more prepared to have at your next appointment? Please take a moment to share your thoughts in the comments section below. Your story and your insights could be incredibly helpful and encouraging to someone else watching this video. And finally, if you found this guide valuable and want more in-depth content designed to help you navigate your health with confidence and clarity, please be sure to hit that subscribe button and ring the little notification bell so you won't miss our future videos. Thank you so much for spending this time with me today. It's a privilege to be on this journey with you. Be well, stay empowered, and I'll see you in the next video.